Welcome to the Protecting Your Nest podcast. One of the gifts of having a podcast is that others who have similar perspectives are able to hear from someone who has the same perspective, which is really wonderful. And as you know, I'm really about helping people achieve metabolic health. And that's important because at times you have self-doubt. You have self-doubt about what you believe, and that are there other people in the community who can actually share those same visions. And thankfully we have a community, in a low carb community, in the metabolic health community, et cetera, where that support is available. I do work in a large health system, one of the largest health systems in the country, and sometimes you feel like a unicorn, one of the few unicorns who understand the value of integrating alternative ways of healing into a traditional medical practice. Thankfully, I have found that I'm not the only unicorn in the world. Yes, even in my large health system, I have found that there may be others who have a similar vision. That's why I have a good friend here today to share her vision with you as well. Today's guest is Dr. Diana Botarri. Dr. Diana is the medical director of the Controlled Substances Monitoring Team, which oversees the prescribing trends for the Advocate Aurora enterprise. Clinically, she is an integrative pain management physician providing holistic pain care, which includes traditional medicines, Botox injections, diet and exercise, acupuncture, cupping, herbal supplements, etc. So Dr. Botarri believes that the only true way to conquer pain is to treat the entire person, not just their symptoms. And she also holds a board certification in integrative medicine, addictive medicine, and pediatrics. She attended the Chicago College of Osteopathic Medicine, completed her residency at Advocate Children's Hospital, and her fellowship at the University of Arizona. And with that, Doctor, I welcome you to the Protecting Your Nest podcast.
I'm so excited to be here, Tony. This is really exciting. I'm happy that you asked me to be a guest.
Absolutely, Diana. I am just as excited. I hate to call you a unicorn, but that's what you are. and it's all good because I am so proud to be described that way. And I just think that in order for us to really help people heal, you have to look at what you're doing, and is what you're doing really answering their questions? Is it really helping them to heal? And when you find there's some gaps there, you have to fill those gaps. And I think we both went crazy and got a lot of extra education, right? So that we can do that. And it's so nice to have you in my health system because, again, we help people live well. That's what our motto is, right? So in order to do that, we need to really understand there are many ways to do that. And some of it is to think outside the box. So let's start our conversation by learning a little bit about you. And so I'm curious, like, tell me about yourself, but more, just as importantly, how do you spend your free time when you're not helping people with pain in our health system?
Well, I'm a mom. I have a 9-year-old daughter, and we recently got a COVID puppy. So that's my first dog ever. So that takes a lot of time. And so my free time I spend with my daughter and my husband. I love to cook. Cooking's kind of my thing. I'm Italian. And so, food is love.
That's right. No
So I
doubt.
do that.
Yeah. And yeah, I'm a big fan of cooking too. In fact, when me and my wife were in, Austin, Texas, there was a conference called KetoCon. And one of the people that we had a chance to chat with was Maria Emmerich. And she's known, she has a ton of books, and she teaches us a little bit about how to do the cooking with low carb or keto. So I'm hoping to hook up with her at some point, make some videos, and hopefully she can sharpen my cooking skills. And but she makes a lot of keto, low carb products, foods that are, it looks like cake, but it's not really made the way we normally make cake. So it's kind of a lot of fun. So let's talk a little bit. You were trained in addiction medicine, integrative medicine, both of those, which is really kind of cool. And so my brain thinks of those as making a ton of sense as it relates to how you help people with pain, right? Because we know a lot of people who suffer from pain may have addictive tendencies, or they may be on medicines that could be addictive. And obviously, you want to be able to integrate uh, alternative forms of therapeutic modalities into their treatment. But pediatrician training, that was a little bit of a disconnect. So, how in the heck did someone with all these different types of training, all that come together to make sense? So, how do you apply that?
Yeah, so it was a little bit strange. So I'm very unusual, and how I came to be doing what I do. So I was, pediatric trained. So I was, I've never practiced general pediatrics, but I did a pediatric training, and then I started working in an intensive care unit, and putting in lines, intubating patients, doing all that fun stuff. And I was asked, or kind of told, we need you to create a sedation service, a pediatric sedation service, and a pediatric pain service.
Hmm.
And so I was like, okay, so, all right, I got to do that. So we started, or I started a pediatric sedation service, which was one of the first in the country, which was non-anesthesia driven sedation services. Now that's very common throughout the children's hospital, but
Mm-hmm.
go back 12 years, that was not common. So what we did back in the day was just hold down kids when we did procedures. So if you did a lumbar puncture, or you did a PICC line, or did those things, you just held them down, and the success rates weren't good. And also it's mean. So we provided sedation, and by doing so, we actually became very good at it. And we also limited how many kids we had to put under general anesthesia. So the options were
Hmm.
either no, you hold down, or other was you knock them out with general anesthesia. And we provided a continuum. So
Nice.
so it was really nice. And I liked doing it because it provided pain control during those procedures. And also I was able to be the mom that couldn't be there, because the mom couldn't be there during the procedure, but I met with kids and they knew me and we worked together, and it was really rewarding. And then the pain service. So we did the pain service, and we were the first hospital in the entire North America to receive designation as a Child Kind Institute. Which, like I said, the very first one, which means we give extraordinary pain care to our kids. So that was amazing. So that's kind of like, any kind of magnet certification, if you're aware of that kind of certification for nursing. This is for the children's hospital. So that was amazing. And I love doing pain management for the kids. So anything from, kids that broke their legs, surgery, abdominal surgery, appendectomies, cancer pain, all the pains that adults have are all the pains that kids have, even low back pain, with the obesity epidemic in children, you do see more low back pain with them. Children tend to have even a stronger psychosocial component to their pain, which just makes them a little bit more interesting, and
Mm-hmm.
getting the mind body in there, and trying to find out what's exactly going on. So so I did that, and then kind of how that transition was. This is during the opioid epidemic, when everybody started understanding what that was, and we started understanding that exposure to opioids at an early age does increase the risk of misuse later. And I kind of started wondering, well, what are we supposed to do? Like,
Mm-hmm.
how do we do this? How do I treat somebody's pain? You can only use so much of NSAIDs and so much gabapentinoids, and what else are we going to do? And so at that time, I was asked to go to a meeting about the opioid epidemic, and I volunteered to be the chair of preventative, because
Mm-hmm.
I felt like prevention in pediatrics that's our game, right? Like that's what we learn. So I was like, oh, I can share this, and then that spiraled into somebody asking me if I could give free Narcan out, if I could do a program like that, and then I did it,
Mm-hmm.
and then I realized that this is a completely stigmatized population that is completely underserved, and those are my people. Like I love the underserved, the beaten down, the ones that are ignored. Those are the patients that I really, really are drawn to,
Mm-hmm.
because I want to help. And so that kind of went through, and I said, well, how many of our doctors can prescribe Suboxone? How many of our ER doctors can do this? Because this is important. And none, like
Mm-hmm.
five could. So I started running campaigns with grant money to get people waivered, because at the time it still required the 8 hours of training to get primary cares to be waivered, to get ER doctors to be waivered. And now every one of our advocate medical group ER doctors in Illinois, every single one of them is buprenorphine waivered. And all 9 of our hospitals in Illinois give away free naloxone. So these are things that like just really kind of got my like passion going. And then integrative medicine fell into that because I was looking and searching for ways to treat patients. And during that time, I also started to learn how to do acupuncture. So I did some extra training in acupuncture as well, because I was like, there's got to be more out there, because
Mm-hmm.
there's no reason why the United States consumes the most opioids and has the worst pain outcomes.
Right.
So out of the whole world, we take in the most opioids, have the worst pain outcomes than anywhere else in the globe. And that like kind of hit me pretty hard on, well, why is that? It's
Mm-hmm.
not like we have more osteoarthritis than somebody else does, and everybody has these type of pains. So what is the difference between the two? So that's where I went into the extra training and became really, really focused on holistic care, and realizing that it doesn't do any good to just treat the symptoms of chronic pain. You really do have to treat the whole person.
Mm-hmm.
So I really wanted to start an integrative pain clinic, and I was able to get backing. And so I created that, and I see adults, I see kids, and I do outpatient now. So I left the inpatient world and went to the dark side of outpatient medicine, which is a little bit different. My whole life I was in the hospital, so
Right.
my whole career, and then I went to outpatient, and so it's been really amazing and transformative to take care of patients that basically not a lot of people want, to be quite honest.
Mm-hmm.
And they are the people that are kind of sometimes forgotten because of the CDC guidelines in 2016. And, we didn't know what to do. And, we had the CDC telling us opioids are bad, and a whole bunch of people stopped prescribing them. Well, there's a linkage to all these things. And
Mm-hmm.
again, this is why this is why opioid stewardship prevention and opioid use disorder kind of all play together, because these things are linked. So we
Mm-hmm.
have a group of people where we were part of the issue, and then we left them kind of out in the cold, and then we
Mm-hmm.
wonder why the death rate keeps going up higher and higher. It's because we didn't provide them with anything.
Yeah.
We just cut them off. And I have a problem with that. So I want to be part of the solution, and I want to educate on it, and I want to teach, and I want to be like, hey, listen, we can do this. We can do this together. But to me, it's very obvious on why this trend is going this way. And I think the answer is also very obvious. So I use my voice to teach and to help, to assist different docs on how to do this. And of course, see the patients myself.
Your passion, I can hear it, and I love that. I've always been impressed with your energy and your enthusiasm, and I'm so happy you're doing something that means so much to you. But it also sounds like you kind of push this agenda forward. And for any clinician listening, or any person, when you have a purpose on the planet, or you see a need, please just push it forward. People literally think people at the top figure out everything, and that's just not true. Sometimes it's kind of a grassroots thing, and I think that's important. You also spoke about, the prevalence of narcotic use. A while ago, when I was doing research for another episode, I learned that, maybe 70% of all drugs, not just narcotics, that were used in the world were used in the good old US of A. Now, that sounds like that can't be true, right? That can't be true. But that's what the report said. So if that's true, we overuse not just narcotics, but we overuse drugs in general, and we don't use other modalities to help people heal. And then, literally, as I was coming to record this episode with you, I was listening to NPR radio, and they talked about, where do you see a lot of monkeypox, right? They were talking about that. And of course, it's in those communities, communities of color, communities with limited resources, and you can almost guarantee that's who's going to be disproportionately impacted. So we need clinicians like yourself who are here to help make sure those communities are not disproportionately impacted. So thank you so much for your words. And so I've been trained. I'll be finishing, yay, my nutrition and functional medicine.
Yay.
And my wife's yelling and screaming too.
Yeah, right?
Yeah, it's like that's almost over. But I know functional medicine is more about the root cause of why we get sick. And so I guess in this conversation, why do people have pain? But integrative medicine is slightly different. So I think it'd be helpful for those who are not as familiar with integrative medicine to help, understand what it is. And just as importantly, how did you find it? And were you battling any personal struggles yourself to recover from?
Yeah. So first of all, I want to say what you said about keep pushing forward is so true. And if you find something that you feel like you've been put on purpose for, whether it's God or whoever you feel like put you there, just keep looking for that window. If the door closes, see what's open. Because I've been told no more times than I've been told yes, and I
Mm-hmm.
just continue with it because I believe in it. So that to me is really important for anybody to hear, for whether they're a clinician or not.
Yeah.
Because I am one of those people. I'm very persistent. I will make you get on my side. But yes, so for integrative medicine, I had acupuncture done on myself. So I have a secondary infertility. So I had a first baby and then I couldn't have a second baby. And so I had acupuncture done, which didn't result in me having a second child, but I was reading all the research on the
Mm-hmm.
fertility acupuncture, and it was a chiropractor that was doing it to me. And I was like, I should know how to do this. Like,
Mm-hmm.
clearly this is, I should know how to do this. So that kind of got my juices flowing of like, wow, this is really cool. And so I started doing it, and I love doing procedures when I was in the ICU. I'm a
Mm-hmm.
procedure person. So like I really had a knack for doing acupuncture, and I was doing it on anybody and everybody. Like you would come into the office in our, our regular office, like not clinical office, but my office, and you
Mm-hmm.
would have nurses, you would have anybody with needles in their face, needles in their, like everybody had needles. So like everybody was, they would come in with headaches or back pain, and I would do it, and they were getting better. And like they would come in specifically. They'd be like, I was going to call off, but I knew you were here today. So I came in, and I have a migraine, or I can't move, my back hurts. And so I would do points for them, and they would get up and go to work. So I was like, holy crap, this does work. And at first I was like, just like anybody who's probably listening, like, oh, it's probably placebo, because, first of all, I have no problem placebo effect, because who cares? If you get better, you get better. Who
That's
cares the
right.
reason why? But it was too consistent with my success on it that I was like, there's something more to this. And it's been around for thousands of years. But I was just having really good results. And then from there, I was like, well, what else? What else is there? And I was like, I really believe in this kind of holistic, and I'm an osteopath doctor. I'm a doctor of osteopathy, so a DO. And we believe in, and MDs get taught the same thing now, but this was unique when DO school started, but that
Yeah.
our bodies do have inherent abilities to heal, and it's about tapping into the ability for the body to heal. We are magnificent creatures, and we have to tap into what makes us magnificent sometimes, So I started looking into it, and I found Andrew Wild's fellowship, and I was like, it took me a minute. I'm not going to lie to you. It took me a minute, because it was a 2-year commitment, and I still had to work full time. And,
Right.
that's not easy to do, and it's expensive. And so I had to kind of take a leap of faith in spending a large amount of money on something that I believed in, and said, I really feel in my gut that I need to do this. And my husband said, I think you do. Like, he was like,
Mm-hmm.
like, Diana, you got to do this. You do.
Mm-hmm.
So I just I'm like, if I don't do it now, then I'm just another semester behind, right? Like I'm just waiting. So I did it. So I joined in, and I was like, let's see how this goes. And, the more I learned and the more I understood and learned about different, all of our 90% of our pharmacopoeia comes from plants, like this is not, this is how we make drugs, is from plants. And some of these drugs that are not utilized by by the pharmaceutical industries, because they haven't figured out how to get that component that makes it special. They haven't been able to get it down to that one thing, or figure it out so that they can make it into a pharmaceutical, right? So knowing that these other things exist and understanding how they interact with other medicines is important. And I think that's that's not the difference with functional medicine, but that's what's the difference with integrative medicine. Integrative medicine is integrating into everyday allopathic, osteopathic
Mm-hmm.
medicine. It is not take this herb so your cancer gets cured. It's not that. It's take the
Mm-hmm.
chemo. It's not, hey, don't worry about your heart disease and, burn some sage. Like, no, that's not integrative medicine. Okay. That's not what we're about. We're not about not vaccinating. We're not about any of those things. We're about how do we add something to this to help the body heal itself? How do we add to it? How do we add motion and movement? And how do we incorporate diet and exercise and sleep? And understanding that we are not just symptoms. We have changed medicine to be individuals' pockets, right? Your heart doctor, your endocrine doctor, this doctor, that doctor, all these little pieces, right? But the truth is that we're one whole person.
That's right.
Our kidneys and our hearts work together, and our pancreas, like all of these things, our brains, everything works as one unit. And when one unit is out of whack, the rest of the units become out of whack. And so that's what we have to focus on. And so to me, that's kind of where I feel medicine kind of has fallen, because we've so subspecialized that, I'm always messaging other doctors. Like, I'm messaging the rheumatologist. Hey, blah, 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 blah. This is what I see. I message the primary care. Hey, look, this patient's now anemic. I think, this is going on. I looked at their diet. Their diet's not good. And I'm adding to it because I'm taking the time to communicate with the other docs, but that's hard to do in a practice.
Yeah.
Because we don't have time.
That's amazing. You're right. And yeah, I learned so much. I've learned that you can be anemic because you have a copper deficiency. I've learned that if you have an irritable bowel, and maybe that's because you got leaky gut, maybe you got leaky gut because your diet sucks, right? So it's like, and if you don't think about those things, you'll just be patching people, and they'll never quite heal. And I just love the fact that this ideal of interconnectedness. That's the term I learned in functional medicine. Everything's interconnected. So we need to think about that, which is kind of what my nest and rope is speaking to. It's like, it's not just your diet. It's not just because you don't exercise. It's what about your relationship? What about your sleep? What about being exposed to things that can harm you, like pollutants in your, it could be something as bad as, simple as the plastic in your water bottle. So I think we need to be aware of that. And then I think about some of the stuff I had not learned. And it speaks to your concept of where the medicine comes from. Well, if you trust a pill that maybe had an origin in medicine, why can't you trust the essential oils, right? There are cultures that use essential oils like crazy. I learned nothing about that in medical school. So again, not to make everybody an integrative specialist, but to say there may be some folk out here, a functional medicine doctor, integrative professional, someone doing alternative and complementary medicine that may be able to give you some insights that can, at least you can test and see if that's going to add value to your life. So I love that. I think about pain. I had a great pain doctor who I actually saw in Austin, Texas as well. He didn't speak, but he was there. Dr. Gurpreet Pata. He's in St. Louis. And he's wonderful in terms of how he deals with pain. I think he also has some extra training in addictive medicine, pain, and one other area. And he always talks about how it's impossible to really treat pain effectively without, dealing with their metabolic health, and obviously you got to deal with their social issues. Like he talks about social isolation. You got to fix that stuff too. So I guess I guess we've answered the question away, but when it comes to integrative medicine and as you treat patients, how important has that been as you've tried to go from the previous way you practice to the current way you practice? How has that impacted that?
I really think that I am a South Side of Chicago girl, right? Like, that's where I grew up. I grew up at a, no, my dad was not involved. It was just my mom. My mom worked 3 jobs. I'm a very down to earth kind of girl. I'm the first one that went to college even, so I like talking to my patients and finding out what's about it. And when I was inpatient, you don't have a limit on the time you can spend. So the biggest thing for me transitioning to outpatient was I was a little bit worried about that, but I was very lucky that I do get a full hour for my initial consults, which I need. There's no way I can do less than an hour. I've timed myself. It is impossible for me to do less than an hour because everybody has a story and people need to tell me the story, because in their telling of the story, I get a lot of information.
Mm.
And we know that in medicine, right? We're taught that. Like a lot of times, if you just listen and don't talk, you actually you figure out what the problem is relatively
Mm-hmm.
quickly. But
Mm-hmm.
our healthcare system is not really built for that time, right? So I'm very lucky that I get that hour, because we do go over, I let them tell me their story. Tell me why you're here. Tell me all about it. And I go through everything they've tried. I go through, tell me about your pain. What is it like? And then we go through, okay, well, what do you, what does it stop you from doing? Okay. So I
Mm-hmm.
always ask, what is pain stopping you from doing? And then the most important question that I ask my patients are, what do you want?
Mm.
And that's a powerful question. And it's really important from a motivational interviewing standpoint, is because if I have a patient that's 67, 71, whatever, who was a construction worker, truck driver, whatever, has degenerative disc disease in the back, has a herniation, I'm not going to make that go away.
Mm-hmm.
This is called gravity, friends.
Mm-hmm.
We live on Earth and we're bipeds. We're going to have DJD at some point. Everybody is.
Right.
So the question is not whether or not I can get you out of pain, because that's not what we're doing here. And I'm very frank with them, is that I'm not going to make you 20. So I don't have the wand. I don't have the magic. I can't make you 20. What do you want? What is it that you can't do now that you
Mm-hmm.
want to do?
Mm.
And then let's focus on that. And it really reframes how they're thinking about their chronic pain, and
Mm.
really going, okay, what is it that I want? And then they tell me. And then they say, I want to sleep in bed with my wife. I want to garden. I want to clean my house. I want to play with my grandkids. They are all really tangible goals, which are beautiful goals, to be quite honest.
Mm.
And then that's what we work towards. And when they have a setback and they're like, well, the pain is blah, blah, blah. And I'm like, okay, are you sleeping in bed with your wife? Well, yeah. Did you garden this year? Yeah. Are you walking again? Oh, yeah. Like, oh my gosh, you reached all your goals. You did the things you wanted to do. Isn't that amazing? And they're like, wow, when you put it that way, I did. And I'm like, yes, you're so much better than you were. These are wonderful things. Like, that's great. You did that. I didn't do it. You did the hard work. And look what you got from this, And that's what patients need to be able to see and hear. When you have chronic pain, it is the best friend you never wanted. It is there when you open your eyes. It's there when you go to sleep. It's there when you
Mm-hmm.
turn. It's there every moment of your day. And so learning how to deal with chronic pain, minimize the intensity, and still live a full life is really important. And that's really where I focus on. And we talk about, who's your social support? How do you move your body? What do you put in your body? How do you sleep? How many hours do you sleep? What time you go to bed? These are simple questions that have a lot of influence on me, of like, well, why do you go to bed at 3 a.m? Well, my husband died last year and I can't sleep. I didn't hear that through the 45 minutes of the conversation. I had no idea that their husband died last year.
Wow.
Or my daughter's going through chemo and I can't stop thinking about her. Like, these are the things I hear as I'm going through it. And I'm like, okay, well, let's talk about that. Let's talk about how we can deal with some of these things. And we talk. And then they feel better, because they feel like there's hope, when they maybe saw 5 different doctors who said, oh, we can't do an epidural, or we can't do an injection or trigger point injection or whatever. But, there's nothing else we can do for you. And then they come see me and I'm like, okay, well, let's talk about the things we can do.
That's
Let's
right.
talk about how we can make your life better. Like, how can we get it? I see these people that are retired and I'm always like, you didn't work this hard to get to retirement to sit at home.
Mm.
That's not why you work so hard. So let's talk about what we want, and that to me is the most powerful gift that I give my patients, is their time to recognize what they want.
I love your ability to help them have gratitude and to reframe how they see the world. And I learned a lot of that, even with the motivational interviewing. It teaches you how to, let's have some tools in our toolkit when we're struggling to help a patient, or they're struggling, how can I, help them see that there's, a disconnect between where they are and where they want to go in their behaviors, and how do I say that in a compassionate way. And I love that. So that's really what it's all about. And what I also love is this idea of, like, palliative care teaches us to have goals of care. And with those short visits, a lot of times you're just trying to check the boxes, make sure they have their medicines, and you don't get a chance to say why. What do you want to? Where do you want to be in a year? What are you trying to achieve? I think that's so important. And I also love the fact, as I've learned in my functional medicine training, that we have the functional medicine timeline, and it forces me to go backwards. And I want to talk about their mama, their daddy. I want to talk about all of that stuff, because something that happened in those early years may have impacted them, or you've been through a divorce, or or you when you had your kids, or you were in your residency, whatever it was that may have been a trauma or a challenge or just an experience that had an impact on you. So I'm so happy that you're in a setting where you can have more time, because you can't help people who are struggling if you don't dive into these little areas, which will then identify the root cause of why they struggle. So I really appreciate that. But I also think about the other clinicians who have your title in pain, right? And so they're pain specialists. And I just wonder, and I know our health system is really more open to alternative and complementary things, because they're now literally saying you're certified for people to refer to you within our health system. So, and that just happened recently, to be honest with you. So I think that things are changing, but I think from your perspective, as it relates to pain clinicians who have always been stereotyped as they just give you pain medicine or shots, right? So do you see any progress in that space at all?
I'm working towards it.
Yeah.
And that's kind of my goal. Is I'm working towards getting, as one of the largest healthcare, corporations that we work for, that's kind of what I'm trying to do, is get the understanding of what type of care this is, and that the care, the epidurals, the facets, the trigger points, all those things are important, but it's all in a spectrum of care, and not everybody gets better from an epidural or facet, and some do.
Mm-hmm.
Some do get better and they don't need anything for a while, and those are awesome,
Mm-hmm.
and we need those. But we do have more patients that have fibromyalgia. We have more patients that have myofascial pain syndromes, rheumatoid, lupus, all these things that cause significant pain, and disability, that we need to kind of help with too. So my goal for us is to make a pain excellence center, and then I hope that others will follow suit with the success of it, because I am positive that it will be successful. That is, I have no doubt. I just don't have any doubt.
That's right.
And I know it will. And so that's kind of my thing, is like, I think we need interventionalists. I think we need other providers that can do medical management and add in these other modalities, and acupuncture and cupping and physical therapy and all these things, to really round out the care of the patient and be able to spend that time. Because my after visit summaries are like, they're very long.
Mm-hmm. Yeah.
They're not short. They're okay. These are the steps we're going to make. And we're going to see you in 2 months. I'm not going to see you in 6 months. I'm going to see you in 2 months, and we're going to check to see what you're doing. And, you better believe it, that whatever's on the list, we're going to go over again. And I'm going to say, did you do this?
Mm-hmm.
Did you do that?
That's right.
And sometimes I have a little fun with them, because some of my patients, I'll see them in 2 months and I'll be like, okay, how are you? And they're like, doctor, I'm still awful. And I'm like, okay, well, did you do X, Y, Z and all this stuff? No. I go, oh, so you're telling me you did the exact same thing you've been doing this whole time, you didn't get better? And they laugh. I'm like, I mean, come on. I'm like, you didn't do anything. Like, of course you're the same. What did you expect to happen? And
Right.
then they're like, okay. They're like, yeah, okay, you're right. I didn't. I was like, all right, let's start again. Okay, let's do the things that we need to do.
That's right.
So I don't see a lot of movement in it. What I do see is a lot of pain doctors that are refusing to see patients that are on opioids, because it is it's a lot of extra time.
Mm-hmm.
And again, time is not looked at in an RVU world the same as a procedure. So a procedure that takes you 10 minutes can give you 4 times the RVUs of spending an hour with a patient.
Mm-hmm.
And that's broken, right? That's really not, that doesn't make a lot of sense. But that's the way it is. And so, people got to pay bills, and it's a lot of work. It's a lot of work to answer all the phone calls. You look at all the urine drug screens, do all the consents, it's not easy. It's not easy. So I don't like that. I understand it. And I'm looking at ways on how we can change some of that. to make more sense for our patients and for people in general, because this is not just our problem. This is the entire United States issue.
That's right. And I am excited. We have the huge advantage that we do have is that we're a population health organization. So thankfully, that will incentivize us to help reduce the cost of care by helping people to do better and help them heal. So if we do a better job, like for example, if as I celebrate, a patient who was able to reduce their A1C from 12 to 4 in like 3 months, right? And got off of all their medicines. um, that type of success will then incentivize us and hopefully the insurers to say, man, what are you guys doing that's different? So I'm just as motivated as you to, in my space of metabolic health and diet can reduce the need for medicines. I'm very excited that our health system will hear that and allow us to help guide them in that space. And then, and we can honor this, we help people live well model. But I do think that you're right. We got a lot of mountains to move because this fee for service model is not designed necessarily to support that. But I think we've already done a lot of great things, rather as an acute care center where we have a multidisciplinary clinic where people can, see a therapist and a behavioral health professional and the clinician and the pharmacist. All of those types of programs will move us closer. So we'll get there. But I'm happy that again you're leading the charge in the integrative and pain space. So if I were to come to you for an hour and spend some time, and you have this extra training, you've mentioned some of the modalities that you would offer me, like acupuncture. So talk a little bit more about what would that visit look like that's different than a traditional pain specialist? What?
Probably the most thing is the time spent in going through all of the things you've tried and didn't work, and more about the history of the pain, like what happened, how did it start, those kind of things. And more like everybody's pretty surprised when I go into a lot about diet. What do you drink? What do you eat? What do you snack on? How much fish do you eat? How much of this? I go through, I want to know how many cups of coffee you have. I want to know those things. I want to know what supplements and vitamins you're taking. How you poop. I mean, like all those things, like I'm going to ask all of them. And then kind of come up with, and also based on your goals, we'll come up with a plan on what I think is best. I use the motivational interviewing, change talk, sustain talk kind of thing that we learn about, which is basically listening for a patient to tell you what they're willing to do and what they're not willing to do.
Mm-hmm.
It's as simple as that,
Yeah.
Really. And so I listen for those kind of words, and then I play on those words. If I know when I ask about exercise, they're like, I know I should, but I can't because of pain, or I can't because of this. Then I'm like, okay, well, let's talk about that. Let's like, how do we change that? What do you think about this? And when I do exercise prescriptions. I do not tell, I've seen in different people's notes, not just our healthcare organization in general, the very generic 150 minutes of exercise per week is what everybody needs, and da 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 da. Well, that's great and everything, but if you have a sedentary person and you tell them to do 150 minutes of working out per week, they will not do any. They will add zero. Because that's a huge ask for somebody who's sedentary. So I always talk about, well, what are you doing? If they have a dog, I'm like, well, what do you think about walking the dog 3 times a week? What about if you think about doing this? Or what do you think about doing chair yoga? Or, and I explain why. I don't just say you should do it. I explain the why behind it. Okay, so you have low back pain. Let's talk about core. This is your core. And if you stand up, and I kind of show them how the lordosis works in your back, how the curvature works, and how it puts strain, and see how the vertebrae bend when you bend that way. And we kind of go through it, and I say, okay, this is how this is going to work. And that gets them more involved and in control of their life, and that's, for many, many years, medicine was a dictatorship. We are the experts. You do what we say and blah, 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 and see you later. And that doesn't work. And that doesn't work. It has to be a partnership of, hey, what can you do? What won't you do? Because, and I'll tell them, like, listen, I'm not gonna put things down that you're not gonna do, because it's pointless, right?
That's
so like,
right.
What are you going to do? And if I say, I want you to decrease the pop and they look at me like I'm crazy, and I'm like, okay, well, what can we do on the pop? Like, okay, how many are we talking about? Can we do this? Or if they eat fast food 7 days a week, I say, okay, what if you eat it 5 days a week? Now that
Mm-hmm.
may not seem like much to somebody. You may be like, but you know what? It's a start. And we have to start somewhere, and we have to meet patients where they're at, not where we want them to be. Because, that's not fun for anybody. The patients don't want to hear what they can't do, or, okay, well, now this doctor, no, she doesn't make, she makes more money than I do. I have to go do this. And what am I supposed to do? And I have this. And there's lots of excuses, and they get very, defensive, rightfully so, that I'm sitting on my high horse telling them what they're doing is wrong. Instead, I'd rather partner with them and say, okay, well, what do you think? What do you think about making better choices? What do you think about this? And, you'll be surprised. I had one woman who was a cancer survivor who was drinking very much so a lot of pop, like
Mm-hmm.
a 12-pack a day kind of pop, and that's a lot of calories. It's a lot of calories. It's a lot of caffeine. It's a lot of things. And her kids got on her really hard on it. And she was crying in my office about it because her kids are beating her up on this pop. And she said that was like the only thing that brought her joy was this pop.
Mm.
And and I was like, okay. And she has lymphedema because of her mastectomy and stuff. And so we went through it, and I said, okay, let me explain to you what sugar does in your body. Let me explain to you why I'm concerned about it, or why I think this might be leading to more pain. And what can we drop it to? How can we work together on this? And the next time I saw her, she's like, Dr. Bottari, I gave up all the pop. I gave it up. And I'm doing kickboxing now. I'm like, you're doing kickboxing? She's like,
Wow.
and I feel so good. She's like, I feel so much better. And thank you so much. And, my kids it was lovely. But I didn't make her. I just told her, like, okay, let's talk about it. I don't take away anybody's joy. I won't do that, but I will explain to you what I'm concerned about. And let's see what we can negotiate a little bit. But you'll be surprised on how many people still don't know what they're drinking is adding so many
Mm-mm.
calories. It's
They don't.
crazy to me. And when I link it to their pain or their hemoglobin A1C, and I'm like, okay, you have peripheral neuropathy.
That's
Well,
right.
your
Right.
hemoglobin A1C is 9.
That's
What are we
right.
drinking? You're drinking regular pop. Okay, well, let's talk about that. And I'm not the biggest fan of diet pop because of microbiome, and that's a whole nother talk. But
Yes.
it's a whole nother thing. But we talk about those things, and I had he's like 400 pounds, back pain, came to me,
Mm-hmm.
went through the whole thing about what he was drinking. He was drinking a whole bunch of Kool-Aid and lemonade and all this other stuff, and he is no longer drinking any of it. His hemoglobin A1C
Mm.
is 5.2 now.
That's
Like,
what I'm talking about.
this is not crazy interventions. This is
No,
talking.
it's basic knowledge
It's
and
basic knowledge,
understanding.
yes, and
That's
explaining
right.
to them at whatever level they may be at, so that they understand how this plays into their metabolic health and how that plays into their pain. And if we link those two together, and they're like, oh, wait a minute, okay, this is okay. It's not just I have to lose weight. It's no. Let's talk about what that means.
That's right.
It's not about the number. It's about the metabolic health of your body. And right now, if your hemoglobin A1C is this, it's not good.
That's right.
It's not good right now.
No.
You know that. So let's work on that. And so it's just basic talking to them. I mean, I had patients off insulin now from type 2 diabetes just
Well,
from me talking
it's
to them.
possible, but that's the whole point.
Yeah.
We still have clinicians who have never experienced that. So in their mind, these chronic medical conditions will always be present. I literally just had a patient um, yesterday who was taking in about 2 liters of soda a day, and I said, well, I definitely I focus on carbs. I was like, well, let's just see how many carbs. We added it up, and in fact, I just Googled, um, 2 liter Coke or soda, teaspoons of sugar, and it was 54 or something like that. So she had no clue. I said, would you ever put 54 teaspoons of sugar in your body ever? And the
Yeah.
answer was, of course she wouldn't. So I think the knowledge part is helpful. And I think for clinicians, you think about again, we're talking about motivational interviewing. I'm just so thankful it was part of my training. Clearly
Mhm.
it was part of your training. And one of it's a lot of acronyms, right? And why do they have all these acronyms, right? And I love acronyms. I have a nest in a rope, but they like acronyms because it's something, it's a tool. So you may not need it for the first, 10 patients you see, but maybe number 11. And like one of them for change talk is darn, what's your desire to change, and what's your ability to change? What's the reasons for change? And then what's your need for change? So I think those types of tools are very helpful. And I really appreciate you talking about, it's almost like, where are you on the scale from 1 to 10? Are you ready to change? Are you not
Mm-hmm.
ready to change? And I think putting it on a scale. And what I also learned in functional medicine is if they say it's a 6, and I'm like, man, it's not a 0, it's not a 1, it's not a 2. Man, that's awesome. That's incredible. And I really admire that. How about, what would it take to make it a 7? It's just the way you talk to people, and you're celebrating where they are. You're coaching them to be a little bit further down the road, but you're meeting people where they are, and I think that's what's so cool. So a lot of what I've learned and what it sounds like you've learned, it's not like you had to learn the acronym as much as the approach, right? Like, how do I approach a person and be compassionate, empathetic, and build rapport so that they'll hear me and I hear them. And then we can make these incremental changes, but just getting rid of that soda is a game changer. I mean, that's
Yeah.
a huge game changer for a lot of people.
And I think
Yes.
since I did come from Pete's, like I celebrate like big style. Like I'm always like clapping and jumping. And I'm like, they're like,
Right.
and I'm like, oh my God, you did that. You started walking. You did this. Oh my gosh, you're doing aqua therapy. Oh, I'm so proud of you. How do you feel? Does it feel good? And I really think celebrating those because, a lot of times in life, a lot of people don't have cheerleaders. They don't have cheerleaders for their health. They just,
Right.
they don't have that person to say, great
No.
job, I'm so proud of you for doing that. They don't have that, and so we all need that as humans. Like, we need the reassurance. Everybody does. And so
Yeah.
I like to provide that to them because I do think it motivates them even more to be like, yeah, I got this.
That's right.
Yeah, I'm
Yeah.
doing it. Yeah,
It's like
it's good.
yeah. It's like
It's
reverse
powerful.
psychology. I was thinking about that question before you even brought up the kids, because there are so many. I remember as a family doctor, and before I started working for Advocate Aurora, I delivered babies and I took care of the babies, right? So I was basically women and children with a few guys scattered, and now it's more adult medicine. But I would have I knew every Barney song.
Right.
Yeah, I still can sing them. I love you, you love me, we're a happy family. I can
Yeah.
go through. So I kind of had a way to engage the young folk. It sounds like you bring that energy. So, and I know you're kind of dealing with adults more now, but back in during that time when you dealt with kids, it sounds like you had to really be creative so that they
Mm-hmm.
would be engaged. So, what are the things that you do back then that you recall that helped to keep them engaged in those interactions?
Everything. Everything and anything. From playing with Play-Doh to being on the floor with them to rocking them, to watching them during physical therapy. So I could see what the pain is because I
Mm-hmm.
could see if is this anxiety? Is it pain? Is it anticipatory? Is it during? What is the facial expressions? Celebrating their wins, jumping up and down, singing their favorite songs with them, doing those kind of things with them just to make them feel more comfortable. But yeah, I've rocked, I have so many lovely children that still write to me. Their parents still write to me. They tell me about what they're doing, all these kind of things that make it really special, for me. Like, it makes it special.
Yeah.
Like, I'm always like, if they're into guitar or they're into music or they're into whatever they're into, I would sit down with them and be like, all right, show me what you got. What are we doing today? And I'd be genuinely interested in what they had to tell me.
Mm-hmm.
And it was really helpful because I want to hear about their friends. I want to hear about
Mm-hmm.
what's not going well and all those things because it makes a difference in their care. It really does. It's, again, we are whole people. We're not just one thing. We're not just a heart problem. We're not just this problem. We are whole
Mm-hmm.
people. And I think the more we can treat people like that. I had this one patient. I thought I was not going to do anything for him. I'll be real honest with you. I was like, this ain't never going to change.
Mm-hmm.
He's 84 years old. He's been on Norco since 1982. not giving my age away, but I was 2 years old when he got hurt. And so like he got hurt that long ago, got crushed, and has been on high dose Norco ever since.
Mm-hmm.
Ever since. And he comes to me because the primary didn't want to give it to him anymore, and it's for chronic headache. And I know that opioids cause headache, right? So I'm like,
Right.
I want to get him off it so bad. And he was very like this. The wife is like, yeah, no. And like, no, 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 no. And I was like, how am I going to make this guy better? He's so miserable all the time. He comes in my office. He doesn't really talk. He has a really, blank affect. I was like,
That's right.
what does he do? Like, how is he living life like this? Like this is like really terrible. And so I kept at him like over and over again. I was like, all right, so this is what I need you to do. When was the last time you were out of the house outside of going to the doctors? And the wife's like, he doesn't leave the house. He sits down on the thing, he watches TV, and he goes to bed. Like, that's his day. I'm like, okay, can you just do you have a porch? Can you put a chair on the porch?
Mm-hmm.
Can you promise me you'll sit out there for 15 minutes a day?
Mm.
Can you just be out in nature 15 minutes a day for me? Kept working on. All of a sudden he comes in and he finally let me start lyric on him. Like, it was like a miracle that he let me do that. Comes in my office, he's talking to me. He's laughing. And I look at his wife and she's like, he's so much better. And he's like, I go, well, how much are you moving? This guy did not walk. I'm like, how much are you moving? He's like, well, now I walk more because you tell me I have to be outside. So I go put the chair out there. I go sit out there because you told me I have to sit out there.
That's right.
And I sit out there. I go, well, do you feel better? And he's like, yeah, I feel better. And I was like, okay, like, I didn't wean his opioids. I didn't do that thing. But you know what? He's better. Like, that's what I want. Like, that's what I want. But it was this simple thing of, this man went to doctor's appointments or otherwise sat on a recliner in front of a TV all the time.
That's all
7 days a week. That's all he did. And just getting him to go outside, and now, he's looking at his garden. He's like, all these things. And these are like such minor, no cost options,
right,
that we could provide. Like, we're not talking about high cost. We're talking about no cost. I do a lot of things that are low cost or no cost. I'm very cost conscious about my herbals and my supplements because those can be expensive. Now,
they can.
The truth is, there's a lot of patients that are on fixed incomes that I ask about what supplements they're taking, and they give me 20. You know what I'm saying? Like, I'm like, why are you taking all this? Like, let's talk about what you're taking. Let's narrow that down a little bit. But I'm very cost conscious. I look and they'll say, well, I can't afford it. I'll be like, okay, this is $20 for 3 months. Oh, well, I can do that. Okay, good. All right, let's talk about, I'm very, very cost conscious. I just am. And I'm always like, okay, if you can pay for your out-of-pocket costs for the Norco or for this or for that, this is just pretend like your insurance covers it. And this is the copay. The copay is $15. Let's just pretend that that's the copay. And nowadays, and one thing that maybe some of your listeners might not know is a lot of insurance carriers actually give an allotment for OTC and herbals. If they call their insurance companies, a lot of them can be paid for. So I didn't realize that. And the more I'm having patients call, like, they'll get $150, a quarter, or like every 6 months for this. So there are some of these benefits a lot of people don't even cash in on. And acupuncture is covered by insurance now. Vast majority of insurance carriers now cover acu. So a lot of things are now out there. You just have to kind of find out from your insurance company what's covered and what you can get.
That's actually very helpful for me because I do not make this up. I think it was yesterday I had a patient who I always fill out written prescriptions for the types of things that are more over the counter. And there are things like turmeric, for example. And I have to do a prescription because she gets reimbursed. My brain didn't think that I need to be mentioning this to patients. Like, I knew that her insurance covered it, but I didn't think there may be other people who are not aware that their insurance covers this. So that'll be a takeaway for me because I need to do that because that stuff is expensive, especially if it's a high quality product. So
yes, and that's what we want them to take. Great. Otherwise, what's the point, right? Like,
that's it, and if we can reduce inflammation with herbal, because again, everything's coming from plants and things, guys, why not help our patients with that? So I think that's awesome. So when I talk to patients, I of course talk about different modalities. Of course, I'm a low carb guy, so I talk about the carb restriction. I talk about exercise, sleep, things like that. Do you have a kind of an automatic, these are the things, it's like a protocol? Do you have kind of to do these things? I know there's some individualizing, but are there certain things you always recommend to patients as a general rule?
I mean, there's things I more commonly recommend. I do recommend a lot of turmeric with
Hmm.
black pepper, because black pepper
Yes.
helps it get absorbed. But turmeric is a COX-2 inhibitor, so it is very similar to a nonsteroidal anti-inflammatory. So those
Right.
patients that cannot take a nonsteroidal anti-inflammatory for whatever reason, this is a nice option for them to be able to do some
That's right.
anti-inflammatory.
That's right.
So I like that one. I do a lot of alpha lipoic acid.
Yes.
Alpha lipoic acid is an antioxidant, and it really helps with nerve pain. And
Yep.
now you can see it advertised, which I think is really funny because I see it on like commercials. I'm like, oh, look at that. Look at mainstream's getting in on this.
Right.
So alpha lipoic acid is one, and magnesium.
Hmm.
Anybody who has restless leg syndrome,
Oh
everybody thinks
yeah.
about muscle cramps, they think potassium. But I'm telling you, magnesium works better than any prescription,
Hmm.
Recrypt, or any of those things that I've ever used. It works amazing. The trick with magnesium is you need to get magnesium glycinate or malate.
Hmm.
The
Hmm.
second word is the salt of magnesium. And the most common one you can find over the counter is oxide or citrate, which is the
Hmm.
kind that stays in your gut that draws in water that helps you poop, which is why
Right.
people can get those relatively easy.
That's
But the
right.
glycinate or the malate are a little bit harder to find, but they get absorbed better. So that's
That's right.
why. So that's probably my favorites. And for my fibro patients, I really try to encourage them to do gluten free for 4 to 6 weeks and see what happens. Because even though they may not have true celiac disease, a lot of fibro patients do have gluten sensitivity that may be leading to leaky gut that's causing a lot of their symptoms, a lot of inflammation. So I have them do it for 4 to 6 weeks. And I will say, very rarely do I have them come back and say they didn't notice a big difference in their symptoms. And just like diet journals and trying to figure out if it's
Hmm.
nightshades. Nightshades are white potatoes, eggplants, tomatoes, those kind of things, because those can be very much so triggers for pain. So I try to have them try to figure out what their trigger is, or I have them identify the stressful situation when their pain gets bad. I think that's something I like to teach about why we feel pain.
Hmm.
Pain is a protective mechanism, but pain again is protective, but that's also includes from emotional. So if
Hmm.
you bottle everything inside all the stress of the world inside you all the time, at some point it's got to come out, and it's going to come out as pain, because pain makes you stop what you're doing. Pain makes you rest. Pain makes you take a time out. And our
Hmm.
brains are very smart about this. So these things are very much so related. So when the back pain gets worse because of X, Y, or Z, I try to put those things together for them so that they can see it, because knowing it gives you a lot more control over the situation.
I love it. Again, root cause analysis. You're writing a journal and you're trying to understand. Is there something I hadn't thought about? Oh, I did this yesterday and now I'm having symptoms, or it's just. And then what's that trigger? What are the things emotionally that trigger me? I tell people stop watching the news. You don't have, I got to know what's going on, doc. No, you don't. You don't have to know that much. And one lady said, I just watch the news so I can see the weather. I said, what kind of phone do you have? An iPhone. I said, okay, pull out that phone and you'll see the weather on that phone. You don't need to watch the news to see what's going on with the weather. So I think we have to, again, reframe how we think about the world. And I guess that's one of my last questions for you is, as you think about the future and healthcare as a whole, what's your vision for how you would like things to look in the future?
I would love it to be. I really would really love it to not be RVU based. I really would like to see medicine go back to value based.
Yeah.
I want medicine to be a partnership. I
Hmm.
want it to be where you can treat a whole person. You can look at things not as check boxes. Check boxes, I
Hmm.
understand why they're there. I get it. But every person's so unique, and they need to be treated that way, and we need to look at them that way to give them the best outcomes we can. And from a pain perspective, again, I tell this, and I know you've heard me say this, but if we start treating pain like a disease, like itself, like
Hmm.
not just the symptoms, but trying to really understand it, we would be much better at treating it, because
Hmm.
really we just treat it as a symptom. Oh, you have
That's right.
DJD, so you have low back pain, or you have this, so then you have that. Like, instead of saying, okay, well, let's talk about your pain, let's talk about how we can treat it, just like we talk about your diabetes, just like we talk
That's
about your
right.
heart disease or high blood pressure. How is your pain doing? What are you doing for it? What can we do to make it better? That's what I hope to see. I'm very optimistic. I think things are moving in the right direction. And I think people, having people like you and, others like us that want this and keep pushing ourselves to be higher leaders within our organization so that we can
Hmm.
have bigger voices, as much of extra work that is. I know it,
Amen.
you know. But us doing that is really what gives me hope, because I think that there is hope. I think there is, and I love what I do. I became a doctor because I wanted to make people feel better. That was absolutely, I at 8 years old, I knew it. That's what I wanted to do, and I get to
Hmm.
live that every single day. And I'm very grateful for that. And I just want to spread it and teach people and be like, hey, we got this. We're gonna make people better. And I love our tagline, and I want to keep us striving to living towards that tagline of
That's
helping
right.
people live well, because that's really what this is about, right? Like, you want to live well. We want people to be healthy. We want them to be engaged. We want all of these things, from mental health to metabolic health to pain health, all of these things. And I think we have all the pieces that we need to make great. And I think we're getting there slowly but surely.
Yep, and I agree with you when you said, I can't make you 20 again, but you don't have to be a 20-year-old to live well, right? You just have to look at your current circumstances, maximize it, and appreciate it, and move forward. So I appreciate that. So in terms of you living well, doctor, you got, I got my nest and rope acronym, and I always like to ask my guests, as it relates to that acronym, which parts are you going to focus on over the next 12 months to make sure you're living your best life as well?
So I have rheumatoid arthritis. So that is, it's an inflammatory, painful condition. I think that's probably why I like doing pain management, because I feel like I
Hmm.
can relate to what they're talking about or how they describe their pain. I feel very, I feel akin. Like, I'm like, I get you. I understand what it's like to have fatigue. I know what it's like,
Right.
to look at your workout clothes and say, I can't even, the thought of putting these on is tiring.
Hmm.
I get it. So what I found for myself is that exercise is really important for me, and that's why I can feel very confident, like, teaching my patients about how I did it and how I get it back in there. But I have to do it.
Hmm.
My joints feel worse if I don't do it. I just don't feel good if I don't do it. So I focus a lot on exercise. My nutrition, I try really hard with nutrition, because I feel like that's what we put in our bodies, what fuels us.
Hmm.
And I feel like I have a daughter, and to me, it's really important that she learns how to eat healthy, and have a really well-rounded meal. I feel, with vegetables, and not vegetables with a whole bunch of cheese on it, but vegetables, like, be able to, enjoy them as they are. So I cook a lot. So that is something that I focus on. And, that's probably the most, that's
Yeah.
kind of my game.
I think that's perfect. A lot of I've had a few guests in the past with autoimmune conditions. Dr. Kristen Bear, I think she was dealing with lupus, and Monique Travis. She may have had RA as well, but and don't get me wrong, they did their thing because I'm a low carb guy via that path. But a lot of successes, and some of them stopped taking their methotrexates and things like that. So I think there's hope. I think again, it's about taking a holistic approach where you're thinking about all of the factors. Maybe we need to get, me and my wife are doing massages now. We're doing sauna now. So just making sure you give your body the best chance to heal and remove the inflammatory foods. And most of those foods are processed foods.
Mm-hmm.
It's the excesses of processed grains and refined sugars. And so if we get rid of all of that stuff, and in some cases seed oils, depending on, I tend to be more interested in coconut, avocado oils, and things like that versus the corn oils and canola oil. So I think if you can remove as much of that stuff, I think life will continue to get better. So good luck with that. I really, 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 really appreciate you spending some time with me today on this episode of the podcast. Do you have anything on social media or ways to connect that way?
So I don't. I have
Yeah.
LinkedIn. That's all I have is LinkedIn.
Okay, that's cool.
Yeah, I'm one of those people that have chosen consciously not to be on social media, even though I know I have a lot to say. But I stick to LinkedIn, and that's my only social media platform. platform.
Well, that's probably a safe place to be. I joined this space once I realized I had to have a platform to teach, and I know you're doing that within our health system. So appreciate that. And who needs to add that extra?
I know.
so, so you
That's to
know,
decrease the trauma and the
yeah,
stress,
right, right,
right?
right. So again, thanks again. I'll say a few comments, but I really appreciate you, and I hope this episode added value to the people who get a chance to check it out. Okay.
Wonderful. Thank you for having me.
Oh, absolutely. And guys, we started our conversation talking about unicorns. Well, I know she doesn't look like a unicorn, but here you go. And I'm proud to be one too. And one of the definitions I saw of a unicorn was a mythical creature that is rare in society. And although I'm so happy that, there are doctors like Dr. Diana who exist in our world, I would be even more excited if there were more unicorns just like her, so that we can teach this healing message, a world where doctors, work with their patients in partnership, right? And a lot of this is a partnership, and that's why that motivational interviewing is so important, where we focus on all of those factors that influence their health. It's a person. Dr. Diana said it's a total person, so we have to think about them mentally, spiritually, and even how they function in their communities. So I really am really excited that we can have clinicians who can take conventional medical practices and combine them with alternative practices to help people heal, because sometimes we're just not getting the results that we desire with our conventional training. So I ask all clinicians who hear this episode, maybe consider adding that additional training to your toolkit, and I ask that they maybe revisit the motivational interviewing principles, so that, and when you interact with patients, you'll have some tools to help you as well. So, and I think that'll really lay the foundation for you to help people heal, because you'll, as the functional medicine timeline teaches us, you'll be able to go backwards and understand how they got from point A to point B. And those little nuggets from the past may provide some clarity. So for those who are checking this episode out, I really appreciate you for joining us today. And I only ask that you continue to be safe, be well, and continue to protect your nest. And thanks again, Diana, for being here today. All
Thank
right.
you.